Hi, I'm Dr. Mangro, a physician in non-surgical spine medicine. Through the course of my education and training at Harvard University and the Mayo Clinic, and now in my private practice, I've taken care of thousands of patients with low and back and neck pain. And I usually do so from an exercise or non-surgical perspective. I'm also a developer of the Spine Nutrition product as a natural alternative treatment for low back pain. Today I want to talk about some of the common causes of lower back pain and how we can relieve those with exercise or non-surgical treatments. So as we think about the spine, there are lots of things that can be a source of pain. One of the most common causes of low back pain are disc issues. People talk about herniated discs or slip discs, bulging or ruptured discs. So the disc is a common source of pain. The disc itself in some ways is like a jelly donut. It sits between the vertebrae and the low back, and it's a cushion in a sense that sits between the vertebrae. If you look at it from the top down, it looks again like a jelly donut in the sense that it has a mostly water center and fibers that run around the outside that and give it strength. The disc itself gets a little bit of wear and tear just with plain living, but sometimes with injuries, and you get small little tears in the disc fibers that line up, create a weak spot, and then the disc may bulge out, and then that disc bulge can crowd the space around the nerves, can give you sciatic or leg symptoms, and then the disc itself can be a source of pain. So that's number one, and that's a pretty common source of back pain. Also, you can get pain related to joints in the low back. So these joints, called the facet joints, can be a source of pain, and they can hurt just like a knee or shoulder or other joints. You can also get arthritis in those joints, again, just like you might in other parts of the body. These facet joints oftentimes will cause pain in kind of a band across the low back. Usually may be worse with just prolonged standing or leaning backwards at the waist. And usually are not associated with a lot of pain that may go down into your butt or legs. Nerves are a common source of pain, so people talk about sciatica, and that usually is a generic term that refers to some level of irritation to the nerve as it comes out from the spinal cord out towards the leg. And so you can get sciatica or nerve pain symptoms that may go down the back or even to some degree, not as frequently, but into the front of the leg as well. And then finally you can get muscle type pain. So you can get muscle sprains or strains, and the muscles sit on top of the discs and the joints and the other tissues, and oftentimes are part and parcel with these other things that can be a source of pain. So that's an overview in a rough sense of some of the common causes of low back pain. In other videos we'll go through and talk in more detail about some of the specific disc or other issues in more detail. For more information, I want to share as a free gift for folks a free ebook on exercise and back pain. You can get that by clicking on the link below. And I'll send out intermittently updates on what's new and current in research related to low back and non-surgical treatments for pain.